I'm Dr. Tina Marcantel, and today I want to talk about postpartum depression, getting to the real cause. So in my clinical setting, I have women coming in that recently had a baby, and they are having similar symptoms such as feeling depressed, mood swings, having mood swings, not sleeping as well. They just don't feel themselves and this like themselves. So this could be like months after they have their baby or years after. Since I delivered my baby, Dr. Marcantel, I've noticed I'm not the same. These are my changes. And then they present with their symptoms. So let's talk about the causes of postpartum depression. So what happens is when a woman gets pregnant, her estrogen and progesterone and other hormones increase. And this is to support the pregnancy. So after she delivers, what happens is there's sometimes an imbalance of the ratio of estrogen and progesterone. There's something called estrogen dominance, in which the estrogen is a bit higher in ratio to the progesterone. Now, this is important because progesterone, let's talk a minute about the role of progesterone. Progesterone is like our natural sedative. It's our natural anti-anxiety, and it's our natural antidepressant. We were born with enough progesterone to have that feeling of well-being. And when that progesterone stays at that low rate, what happens is we start to feel these symptoms. So the next question is, how do we detect this? How do we detect this imbalance of the ratio of these two hormones? We simply do a saliva test, all right? So I choose a saliva test over a blood test because I find that it's much more accurate, and thus I can give a better protocol for my client. So the signs and symptoms that she comes in with usually line up with the results of the test. And usually what I hear is, oh, Dr. Marcantel, I'm not crazy after all. I'm having these symptoms and they're real, and we can detect them by a saliva test. Whereas the blood test is really not checking the active form of the hormones, and so it's not as sensitive. It's a simple test that you can bring home and spit in a tube and send it off, and we usually get the results within 10 days to up to 2 weeks. So what is the treatment here? Let's talk just a little bit about the treatment. What we do is we support the liver to help the metabolism of the estrogen. All right, so the estrogen can come down a little bit because we have estrogen dominance. And what we also do is we increase the progesterone, and we do this with natural hormone therapy. What makes this different in this treatment plan is one size doesn't fit all. We base the amount of hormone treatment depending on the individualized results from the saliva testing. So this is how we get much better results, is from basing our treatment plan on the results of the hormone test. So I hope this was helpful for you all, and thanks for watching.